You're listening to the Bare Metal Cyber Prepcast, created to help you succeed in your educational journey. Learn more at baremetalcyber.com, where additional prepcasts, books, and training materials await. Let's get started. The Health Insurance Portability and Accountability Act, commonly referred to as HIPAA, includes a privacy rule that serves as the cornerstone of health information protection in the United States. This rule governs how personal medical details classified as protected health information, or PHI, can be collected, used, and disclosed. Its purpose is twofold: to protect individuals from unwarranted intrusions into their health privacy, and to permit the secure and efficient flow of information needed for quality health care. The privacy rule therefore attempts to strike a balance between individual rights and operational needs. For learners, understanding HIPAA begins with appreciating its scope. Unlike broader consumer privacy frameworks, HIPAA applies specifically to the health sector, creating detailed obligations for those who hold or transmit patient data. Its framework defines who must comply, what information is covered, and how it may be handled in both everyday care and exceptional circumstances. Covered entities are the primary organizations directly subject to HIPAA. These include health plans, which administer insurance or payment benefits, healthcare clearinghouses, which process standardized data formats, and healthcare providers who transmit information electronically in connection with certain transactions. This scope ensures that not only hospitals and physicians but also insurers and intermediaries are bound by privacy obligations. For learners, this definition highlights HIPAA's focus on the formal healthcare system. It explains why some wellness apps or non-traditional health tools may fall outside HIPAA's scope unless they are directly engaged in covered transactions. Recognizing who qualifies as a covered entity is essential, as it determines when HIPAA applies and when other privacy rules must be considered. Closely linked to covered entities are business associates. These are service providers that handle PHI on behalf of covered entities, such as cloud storage vendors, billing companies, or analytics firms. Business associates are contractually bound through business associate agreements to follow HIPAA's privacy and security rules. This extends accountability beyond the hospital or insurer to the broader ecosystem of vendors that process sensitive health data. For learners, the concept of business associates demonstrates HIPAA's recognition of the modern healthcare environment, where third parties play integral roles in managing information. It also illustrates how legal responsibility flows downstream, ensuring that privacy protections persist throughout the chain of data handling. Without this structure, covered entities could easily outsource risk without accountability. At the heart of HIPAA is the concept of protected health information, or PHI. PHI refers to individually identifiable health information held or transmitted by a covered entity or business associate, whether in electronic, paper, or oral form. This includes obvious items such as medical diagnoses and lab results, but also less obvious identifiers such as billing records, appointment schedules, or even photographs linked to medical care. HIPAA also introduces the idea of a designated record set, which refers to the group of records maintained by or for a covered entity that is used to make decisions about individuals. For learners, this definition highlights HIPAA's breadth. PHI is not limited to clinical data but encompasses administrative and financial records when they tie back to health. This broad framing ensures that privacy protections extend across the full spectrum of medical information. The privacy rule specifies circumstances under which PHI may be used or disclosed without special permission. These permitted purposes fall into three core categories: treatment, payment, and healthcare operations. Treatment includes sharing information among providers to coordinate care. Payment encompasses disclosures necessary for billing and reimbursement. Healthcare operations involve activities such as quality improvement, auditing, or compliance checks. For learners, this trio forms the backbone of HIPAA's operational balance. It recognizes that privacy must coexist with the need for efficient, effective care. Without these allowances, every routine exchange would require authorization, creating inefficiencies that could harm patients. Understanding these permitted uses helps learners see how HIPAA structures the flow of information in a way that prioritizes care delivery while safeguarding confidentiality. To prevent unnecessary exposure, HIPAA requires the application of the minimum necessary standard for uses and disclosures not related to treatment. This means covered entities must limit PHI use to the least amount of information required to accomplish the intended purpose. For example, if an insurer needs information to process a payment, only billing-related details should be shared, not the entire medical record. The standard encourages thoughtful evaluation of each disclosure, reducing the risk of oversharing. For learners, this concept reinforces the principle of proportionality in privacy law. It demonstrates that even when data use is lawful, it must still be restrained. The minimum necessary rule is a practical safeguard, nudging organizations to pause and consider what is truly needed before transmitting information. Another key component of HIPAA is the Notice of Privacy Practices. Covered entities must provide this notice to patients, outlining how PHI may be used and disclosed, what rights patients have, and how they may exercise those rights. Notices must be written in plain language, distributed at the first service encounter, and made readily available thereafter. Patients are often asked to sign an acknowledgement of receipt, ensuring awareness. For learners, this requirement underscores transparency as a foundational principle of HIPAA. The notice is not simply paperwork, but an essential communication tool that bridges regulatory obligations with patient empowerment. When patients understand their rights and how their information is handled, trust in the health system strengthens. Authorization requirements arise when uses or disclosures of PHI extend beyond permitted purposes. For example, if a hospital wanted to share patient information for a marketing campaign or research unrelated to treatment, it would need explicit, written authorization from the individual. Such authorizations must specify the information to be disclosed, the purpose of disclosure, the recipient, and an expiration date. For learners, this demonstrates HIPAA's respect for individual autonomy. While the law creates allowances for essential healthcare functions, it preserves individual choice for all other contexts. Authorizations empower patients to decide whether their information should be used in ways that extend beyond care and operational necessity. HIPAA also grants individuals the right to access their own health information. Covered entities must provide access within 30 days of a request, with limited exceptions. Patients can request electronic or paper copies and may direct that information be sent to third parties. Reasonable, cost-based fees may be charged, but these cannot be excessive. For learners, this right reflects the central principle that patients own their health information, even though it is held by institutions. Access empowers individuals to make informed decisions, coordinate care, or monitor accuracy. It aligns with the broader philosophy of patient-centered care, recognizing that informed patients are active participants in their health management. Beyond access, patients have the right to request amendments to their health records. If a patient believes information is inaccurate or incomplete, they may ask for a correction. Covered entities must either make the amendment or provide a written denial with reasons. Even when a request is denied, the patient has the right to submit a statement of disagreement, which must be appended to the record. For learners, this process illustrates HIPAA's recognition that records are not infallible. Allowing individuals to request amendments balances institutional authority with patient experience, ensuring that health records better reflect reality. This provision strengthens both accuracy and fairness in health information management. The privacy rule also provides patients with a right to an accounting of disclosures. Covered entities must document and provide a list of certain non-routine disclosures of PHI made in the prior 6 years. This includes disclosures for purposes outside of treatment, payment, or operations, such as those made for public health or law enforcement. For learners, the accounting right underscores HIPAA's commitment to transparency and oversight. It gives individuals a retrospective view of where their information has traveled, providing assurance and accountability. This provision demonstrates how HIPAA goes beyond theoretical rights by creating mechanisms for individuals to monitor the flow of their information. Patients may also request restrictions on disclosures of their information, though covered entities are not always required to agree. One notable exception is the special restriction for out-of-pocket payments. If a patient pays a provider fully out of pocket, they may demand that the information not be shared with their health plan for reimbursement purposes. Covered entities must honor this request. For learners, this exception highlights HIPAA's flexibility in respecting patient choice. It provides a mechanism for individuals to exert control in specific circumstances, demonstrating that the privacy rule accommodates nuanced real-world needs. The right to request confidential communications further empowers patients. Individuals may ask providers to use alternative addresses, phone numbers, or other means of contact if disclosure could pose a risk. For instance, a patient experiencing domestic abuse may request correspondence at a P.O. box instead of their home. Covered entities must accommodate reasonable requests. For learners, this right underscores HIPAA's sensitivity to diverse circumstances. Privacy is not only about data security, but also about protecting individuals in vulnerable situations. Confidential communication provisions embody the human dimension of privacy, recognizing that disclosure can carry risks beyond information misuse. De-identification provides another pathway for data use while protecting privacy. HIPAA allows information to be considered de-identified if it either undergoes expert determination that the risk of re-identification is minimal, or if certain specific identifiers are removed under the safe harbor method. These identifiers include names, dates, addresses, and other fields that could reasonably identify an individual. Once de-identified, data is no longer subject to HIPAA restrictions. For learners, this concept is crucial because it demonstrates a balance between privacy and utility. Health data can be used for research, policy, and analytics without compromising individual privacy, provided safeguards are applied. Finally, the privacy rule allows disclosures in the public interest and for societal benefits. These exceptions include reporting communicable diseases to public health authorities, cooperating with oversight agencies, or responding to lawful requests from law enforcement. Such disclosures must still follow safeguards, limiting information to what is necessary. For learners, these exceptions show that HIPAA recognizes the need to balance individual rights with community welfare. Privacy protections are strong but not absolute. In matters of public health or safety, limited disclosures may be justified. Understanding these exceptions helps learners see HIPAA as a framework that integrates individual rights with broader social responsibilities. For more cyber-related content and books, please check out cyberauthor.me. Also, there are other prepcasts on cybersecurity and more at baremetalcyber.com. Psychotherapy notes receive special protections under the privacy rule, distinct from general medical records. These notes are maintained separately by mental health professionals and document private impressions, analyses, and counseling conversations. Because of their sensitivity, they cannot be disclosed for most purposes without explicit patient authorization. Even other treating providers typically cannot access them unless the patient consents. For learners, this provision underscores HIPAA's recognition that some categories of information carry heightened privacy needs. Protecting psychotherapy notes preserves the trust essential to effective counseling relationships. Patients are more likely to engage openly with therapists if they know their most personal disclosures are shielded from routine operational use. The rule strikes a careful balance, ensuring necessary protections while allowing critical information to flow in emergencies or when required by law. Marketing communications represent another special area of HIPAA regulation. Covered entities may not use PHI for marketing purposes without explicit authorization from patients, except in narrow circumstances such as communications about care-related products or services. Even fundraising solicitations must give patients the ability to opt out. This provision prevents health data from being leveraged for commercial gain without consent. For example, A hospital cannot share patient information with a pharmaceutical company to promote medications without first securing authorization. For learners, this demonstrates how HIPAA draws lines between care and commerce. It ensures that health information remains primarily a tool for treatment and patient benefit, not an avenue for targeted advertising. Research uses of PHI are permitted under specific pathways designed to balance scientific advancement with privacy. One option is obtaining authorization directly from participants. Another is securing a waiver of authorization from an institutional review board, provided that risks to privacy are minimal and justifiable. HIPAA also allows for the use of limited data sets stripped of certain identifiers, subject to data use agreements. For learners, these pathways highlight the law's recognition of the societal value of research. They also illustrate the importance of governance. Ethical review boards and contractual agreements act as safeguards to ensure that research serves legitimate purposes without exposing individuals unnecessarily. The privacy rule also defines how PHI applies to personal representatives, minors, and deceased individuals. Generally, personal representatives, such as parents or legal guardians, exercise the privacy rights of the individual. However, states may establish additional rules for minors, balancing parental authority with adolescent confidentiality in sensitive care areas. Deceased individuals retain protections for 50 years after death, reflecting ongoing sensitivity around health information. For learners, these provisions show how HIPAA accommodates different life stages and circumstances. Privacy is not static. It evolves to reflect both legal authority and respect for personal dignity, even beyond a person's lifetime. Some organizations qualify as hybrid entities, meaning they perform both covered and non-covered functions. A university, for example, may operate both a health clinic and an academic department. HIPAA allows these organizations to designate their healthcare components as subject to the privacy rule while separating other functions. Similarly, organized healthcare arrangements allow multiple providers to coordinate under shared compliance frameworks. For learners, these structures demonstrate HIPAA's flexibility in accommodating complex institutions. They ensure that privacy obligations attach where appropriate, without imposing unnecessary burdens on unrelated functions. Proper designation and coordination become critical governance tasks in such settings. Health information exchanges, or HIEs, facilitate the sharing of PHI across providers and systems to improve care coordination. The privacy rule permits participation but requires role-specific safeguards to ensure data is exchanged securely and lawfully. Each participant remains responsible for compliance, and exchange operators often assume added duties around access control and auditing. For learners, HIEs illustrate the tension between interoperability and privacy. While seamless information sharing improves treatment, it also increases the importance of clear governance frameworks. Regulators emphasize that efficiency must not come at the expense of confidentiality. Compliance in this space requires both technological and organizational vigilance. Verification procedures are another operational requirement under the privacy rule. Before disclosing PHI, covered entities must take reasonable steps to verify the identity and authority of the requester. This could mean checking identification, confirming legal authority, or relying on professional judgment in emergent situations. For learners, this requirement reinforces the idea that privacy is not just about policies but about everyday practices. Verification ensures that disclosures are intentional and appropriate, not the result of mistaken identity or fraudulent requests. It embeds a culture of caution into routine workflows, reducing the risk of unauthorized disclosures. The privacy rule also imposes duties to mitigate harm, establish sanctions, and provide mechanisms for complaints. If a disclosure occurs improperly, entities must take steps to lessen any resulting harm, such as by notifying individuals or restricting further access. Workforce members who violate policies may face sanctions, creating accountability. Patients must also have clear channels for filing complaints with both the provider and the Department of Health and Human Services. For learners, these provisions highlight HIPAA's enforcement philosophy. Prevention is ideal, But when mistakes happen, organizations must respond responsibly. Compliance is therefore both proactive and reactive, requiring systems to anticipate and address failures. Documentation and record retention are also emphasized. Covered entities must maintain written policies, patient authorizations, and notices of privacy practices for at least 6 years. These records serve as evidence of compliance and are essential during audits or investigations. For learners, documentation illustrates a recurring theme in privacy law. If it is not documented, it may as well not have been done. Retention requirements ensure that organizations can demonstrate accountability over time, reinforcing transparency and preparedness for oversight. HIPAA also establishes a framework for preemption of state laws. Generally, HIPAA overrides state provisions unless the state law is more stringent in protecting privacy. For example, if a state gives patients quicker access to their medical records than HIPAA requires, the state standard controls. For learners, preemption demonstrates the interplay between federal and state systems. HIPAA sets a baseline, but states may raise the bar. Understanding this hierarchy helps organizations navigate compliance across jurisdictions and underscores the need to track state-level developments alongside federal rules. Workforce training is a crucial operational requirement. Covered entities must train all workforce members on privacy policies appropriate to their roles. Training ensures that nurses, administrators, IT staff, and billing clerks all understand how HIPAA applies to their daily responsibilities. For learners, this requirement illustrates that compliance is not confined to compliance officers. Every member of the workforce becomes a guardian of privacy. Effective training fosters a culture where privacy awareness is embedded into routine tasks, reducing the likelihood of accidental disclosures or missteps. Business Associate Agreements, BAAs, formalize the obligations of service providers handling PHI on behalf of covered entities. These contracts must specify how PHI will be safeguarded, limit its use, and require downstream compliance. For learners, BAAs show how HIPAA extends accountability into vendor ecosystems. They are not mere formalities but enforceable agreements that establish clear lines of responsibility. BAAs ensure that covered entities do not lose control of PHI simply by outsourcing functions. They make compliance a shared duty across interconnected organizations. The Office for Civil Rights, OCR, within the Department of Health and Human Services, enforces the privacy rule. OCR investigates complaints, conducts audits, and can require corrective actions. While monetary penalties are possible, the emphasis often lies in achieving compliance through corrective action plans. For learners, OCR's posture reflects a balance between deterrence and remediation. The goal is to encourage improvement, not merely to punish. Organizations that cooperate with OCR typically work under monitored plans to address deficiencies, while willful neglect or repeated violations invite harsher consequences. This enforcement model reinforces the importance of proactive compliance. Finally, HIPAA requires organizations to designate privacy officers and compliance committees to oversee implementation. These roles ensure that policies are not static documents, but living frameworks updated in response to new risks and regulations. Privacy officers serve as points of accountability, while committees provide oversight and coordination across departments. For learners, governance roles highlight the organizational dimension of privacy. Effective compliance depends not only on individual vigilance, but also on structured leadership. By institutionalizing privacy governance, HIPAA ensures that protections are embedded at strategic and operational levels. In conclusion, the HIPAA privacy rule establishes a robust framework for protecting personal health information. It balances individual rights with permitted uses, emphasizes minimization, and requires documented governance. Through provisions addressing psychotherapy notes, marketing, research, verification, training, and vendor contracts, the rule creates a comprehensive system of accountability. For learners, the privacy rule demonstrates how privacy principles are operationalized in one of the most sensitive domains of human life. It is both a practical guide for compliance and a statement of values about the dignity of patients and the trustworthiness of healthcare institutions. Thanks for tuning in to the Bare Metal Cyber Prepcast, your trusted source for cybersecurity news and insights. Remember to subscribe at baremetalcyber.com so you never miss an update. And visit cyberauthor.me for best-selling cybersecurity books that equip you with expert knowledge. Until next time, stay secure and stay vigilant.